is required in these cases and rule out sepsis. Last, coming to heat stroke. Now, we should give little more attention to this because this is what is likely to kill the child or cause mortality. In this, the most important feature is there will be altered mental status in heat stroke. There will be disorientation, delirium, seizures, obtundation with elevated core body temperature going more than 40 degrees centigrade or more than 104 Fahrenheit, and without any prior signs of stroke, history of infection, or signs of medication overdose. Or there can be altered mental status with hot and dry skin. Remember, it is not sweaty skin, it is dry skin now, and deranged vitals, tachycardia, tachypnea, white pulse pressure. And it should happen during the heat wave season, that is between March to July. This is more common. So in heat stroke also, what needs to be done? This is a case where the child has to be admitted and will require intensive care monitoring. So admit the child, check airway breathing circulation, give oxygen, give IV fluids, do these tests, random blood sugar, as was told by previous speaker also. Hypoglycemia is common in this condition. Arterial blood gas, there may be lactic acidosis, there may be metabolic acidosis, electrolytes may be deranged. Liver function test, your OTPT might rise, can go more than 1000. Renal function test, urea creatinine will be deranged. Coagulation profile will be deranged, may be deranged, and neuroimaging to rule out any CNS bleed, etc. Now, if still we have a doubt about between heat exhaustion and heat stroke, this should clarify it, that in heat exhaustion, there will be increased thirst, weakness, extreme tiredness, fainting, muscle cramps, nausea, vomiting, irritability, headache, increased sweating, but there will be cool, clammy skin. There will be sweating, and body temperature will not rise beyond 104 or 105. On the other hand, heat stroke will have severe headache. The neurological features will be very prominent, will be confused, fast breathing, rapid heartbeat, hard to wake up or can't wake up, seizures may be there. Here it will be dry skin, flushed, hot and dry skin, and body temperature will go beyond 105. Why this distinction is important? Because heat stroke is something where immediate and intensive care management is required. Now, what are the danger signs? Like we read about danger signs in IMNCI also for children. So the danger signs are refusal to feed, excessive irritability, decreased urine output, dry oral mucosa and absence of tear or sunken eyes, lethargy, altered sensorium, seizures, bleeding from any side. All of them are danger signs. So this should be known to us. Now, coming to the management of the other problems like heat edema, prickly heat, cramps, and tetany. So mostly it has been mentioned, but just few more things if it has not been mentioned so far is that for heat edema, as I said, elevate the leg. It usually resolves spontaneously in few weeks. Compressive stocking can help, and diuretics are not effective. That is very important. In prickly heat, you can use antihistamine and wear clean, light, and loose-fitting clothes. Avoid sweat-generating situations. Chlorhexidine in a light cream or lotion base is okay. Calamine lotion is also okay. In heat cramps, fluid and salt replacement, IV or oral, and resting in a shaded, relaxed environment. And heat tetany, calm the patient to reduce respiratory rate because that hyperventilation is causing respiratory alkalosis, and so tetany will be more aggravated. And remove from hot environment. Calcium will also help in this case. In heat syncope, as I said, rule out other causes of syncope, and IV drip may be required in this. And heat exhaustion, remove the patient from that hot area. Volume replacement is necessary. Put an IV line, give IV fluids. Aggressively cool the patient to core temperature 39. As was told by the previous speaker also, that you should have a target of around 101, 102. And then stop, because if you keep on going, otherwise hypothermia may occur. And in heat stroke also same thing, but here it is much more severe in nature, and so there will be requirement of intensive care monitoring, and also a lot of investigations might have to send because multiple organs may be getting damaged or multiple organs may be affected in heat stroke. Now, what about hospital preparedness for heat season? I'm not too sure if it has been discussed. So this is a basic minimum should be there in any hospital, irrespective of where the hospital. You should have dedicated bed for these heat-related illness patients. In a cooler area of hospital, everything is important. You should have thermometer, ORS packets, ice packs, BP apparatus, silver sulfadizine cream, calamine lotion, chlorhexidine, cold IV normal saline, dextrose 50% in water solution, glucometer, testing strips, ECG equipment like ECG machine, gel, electrodes, ECG paper, You should have cooling equipment, AC, cooler, fan as per requirement. Water cooler should be there. In medicines, as was told by the previous speaker also, that the best drugs are lorazepam, diazepam. It will help in seizures also and also in shivering also, because there may be severe shivering when the patient is getting cold. And you should have ambulance facility with ice packs and cold water. Now, regarding prevention of heat-related illnesses, as I said, always prevention is the best policy. Prevention is better than cure. So always look out for the weather warnings issued by Indian Meteorological Department. Teach kids to always drink plenty of liquids, water, and salt water, or all those Indian ampanna, nimu pani, and all those before and during any physical activity in hot sunny weather, even if they are not thirsty. This is very important to tell them. Make sure kids wear light colored loose clothing. Remind kids to look for shaded area and rest often, because they would like to play outside. So they should be told that, okay, intermittently you come to shaded area and rest for some time. Avoid activities during peak summer, as I said, between 12 to 3 p.m. Don't let kids participate in heavy activity outdoors during the hottest hours of the day. And teach kids to come indoors immediately whenever they feel overheated. So continuous, education of them, and, role modeling, telling them, ensuring that they have water with them. All those things are important. And very important, never leave a child alone, not accompanied, inside a parked closed vehicle, because inside vehicle it will be very, very hot. First aid, like before reaching the hospital, what the school can do, or in community it can be done. First and foremost, bring the child indoor first, or into the shade first, immediately from that hot area, or from that overheated area. Remove the clothing of the child while maintaining the dignity. Have the child lie down, raise the feet slightly, because that will help in if there's hypotension developing, or if some cardiovascular compromise happening. Increase airflow to child using fan. Spray normal tap water or tepid sponging. Just remove the clothing as much as possible, and then just spray normal tap water and put a fan over it. That's it. If the child is alert and awake, then only give frequent sips of cool, clear fluids, because that also should go simultaneously. But if the child is vomiting, or the child is not alert, awake, then it is not correct to give any fluid. Just, in fact, turn to their side to prevent choking. And as I said, if the child is unconscious, don't give them anything to drink or eat. Now, this algorithm is the last slide, where what we should do in healthcare facility. So again, ABC, airway, breathing, circulation, quick assessment of neurological impairment, quickly get an IV line, send relevant investigation, as I've already said. If there is features of shock like tachycardia, hypotension, or CFT, keep giving normal saline boluses. Each one is given 20 ml per kg per dose over 10 to 20 minutes, and you can repeat it maximum up to 60 ml per kg, but be sure that there is no fluid overload. And then, of course, issued active cooling measures, like, as I said, remove all clothing, keeping patient's dignity in mind, cover with a thin wet sheet and spray cool water. Ice packs can be used over head, neck, groin, and axillary regions. Use mist fan, evaporative method, tepid sponging, cool blankets if available. Make the child lie down, raise the feet slightly. Very important. Avoid paracetamol and NSAIDs. It has got no role in this condition. Rather, it will create problem for us. Consider gastric lavage with cold saline, that is permissible. Then these patients or the children should be closely monitored. Temperature should be taken every 15 to 30 degrees, and never overcorrect to 38 or below. Stop at 39. Even hypothermia can be fatal. Vital signs should be seen. Cardiac rhythm, ECG, mental status should be frequently monitored. Look out for two things. One is hypothermia, that you can ensure once you should stop cooling once the temperature has reached 39. And while giving fluids, remember that acute pulmonary edema can also occur. So be on guard and don't give unnecessary fluid also. Then, as I said, for seizures, midazolam or lorazepam are the best one, and you should give that much only. And for shivering prevention, again, the same one can be used, midazolam or lorazepam, or if the child is already intubated, then paralytic agent. Look for signs of coagulopathy. You should do ABG to look for metabolic acidosis. CT brain is done to look for complications or to rule out any other intercranial pathology. And you continue management and refer to intensive care unit if your hospital doesn't have a proper intensive care unit. And of course, inform the parents and other people who have brought the child about the patient's condition and prognosis. Ma'am, I've finished here. I would like to take any questions regarding heat-related illnesses in children. I've finished.
Uh, Thank you very much, Dr. Shaw, for that very informative session on pediatric HRI management. I had one question that, like earlier, we saw that in adult patients, it is very important to have immersive cooling, but I think in children it is different. So, what is the best cooling method for children?
Yeah, so children, as I said, the first thing is bring from outdoor to indoor. I mean, that situation first avoid that overheated place. You first bring the child inside in a shaded place, and then, as I said, remove clothes as much as possible, and then just sprinkle water.
Hmm.
Water, even normal water will also do. If you have, ice and all, bring them, put on the groin, axilla, and all those, or just
Hmm.
put water and just put a fan over it.
Hmm.
So just by evaporation also, no, the child will be cooled. So this much
Okay.
of basic thing can be done everywhere, I feel. And as was told by the previous speaker also, it is how rapidly you are doing, how
Hmm.
fast you are doing, and rather than waiting for vehicle to come to hospital, this much one can do there itself. Anywhere it
Hmm.
can be done rather. So that I would say is the best policy for children.
Yes. So for both adult and children, on-site cooling, wherever the patient is found,
Yes,
the
on site.
cooling them on-site is most important. I think in that case, ambulance preparedness and also sometimes teaching, first responders may be useful for finding and early treating